We got people zooming in, so we're just going to kind of go through a presentation here about the guidance for GLP-1s. This is a really casual lecture, so if you have questions as we're going through, please let me know. But also virtually, if you have questions, I am sorry I cannot see if you type in a question or if you say something. I might be able to hear it, but feel free to contact me directly, and you'll get my email off of the end of this lecture. Yeah, so we're going to go through this, the guidance for GLP-1s. So I want to do a brief introduction here. So my name is Vic Troja. I'm the physical therapist, nutritional therapist, and a personal trainer here at the Cincinnati Sports Club. Sarah Curry, who is unable to make it today, she is a nurse practitioner and a primary care provider, and she has helped me put together this lecture. And basically what we're going to talk about today is an intro to what a GLP-1 is, an introduction to this medication, how it's mainstreaming the fitness industry today, and more importantly, what you should be doing. So I'm going to help you guys kind of get some guidance along this as we go through, but like I said, please feel free to ask any questions as we go through. Okay, so here are the talking points today. We're going to talk about what is a GLP-1 medication, what are the different types, what to expect when you're on the medication, the prescription, the dosages. You're going to also see what does research say about it and some of the concerns that might come along with that. And then also what are you supposed to do with it as far as strength and training, nutrition, all of those good things. And then some of the important clinical findings that we're seeing today. So as we go through, we're going to kind of just give you a brief intro. This is not supposed to be science class, so we're going to kind of just briefly cover some of this. But what you see is you're going to see two types of medications, okay? The first type is a GLP-1, and the second type is what we call like a GIP. So a GLP-1, basically, the only difference is that's a hormone that's produced by L cells, where a GIP is a hormone that's produced by K cells. But a GLP-1 basically stimulates insulin production, it blocks glucagon, it slows your stomach emptying, gives you like the increased satiety feeling. So where GIP is a little bit different type of medication, but that basically is supposed to promote beta cell growth in your pancreas, which basically produces insulin for you. And we're going to talk a little bit about insulin when we get down in a few slides here. So GLP-1 is like a peptide. Think about this, a hormone in your body, and it does all of these things, okay? The reason why you're probably seeing so much of an effect on this is that a GLP-1 is affecting like 17 different body parts. So for you, it's gonna not only make an effect on like, you know, your weight loss, your inflammation, it's going to also affect like things like your joints. It's going to affect how your blood pressure acts. So for the average person, you don't need to memorize this, but there's a couple things that I want to just help identify that you might be hearing about. So in your stomach, these medications decrease glucose uptake, okay, decrease the amount of glucose that your body absorbs. And then it also, or it increases your glucose uptake, but it decreases gastric emptying. Do you guys know what that is? Gastric emptying is basically like your body's ability to get rid of waste. So what this does is when you have a higher GLP-1 or hormone content, your stomach feels fuller because it's not emptying as fast, okay? Therefore, you feel more satiated. So this slide basically is just an idea of like what a GLP-1 does. So there's two types, like we talked about. GLP-1 is
recording in progress.
Is a semaglutide, and the GLP and GIP combination is called a tirzepatide. So what you're going to see is you're going to see people call this like, oh, I'm taking a semaglutide, or oh, I'm taking a tirzepatide. Basically, a semaglutide is into two categories. One category of the medicine is for people that are given this prescription for weight management and weight loss, and then the other one is given to them so they can tailor for their diabetes medication. So Ozempic is used more for the diabetes, where Wegovy is used more for the weight loss. This actually has no chemical difference, okay? It's just what your primary care provider prescribes. Do you have diabetes? Then you're probably going to be given an Ozempic, or if you're given a tirzepatide, you're going to give a Mounjaro. Versus if this is just for weight loss alone, they're going to give you something called Zepbound if it's a tirzepatide, or Wegovy if it's a semaglutide. Now, the big thing to understand here is that these are two different acting medications. So GLP-1s act one way and GIPs act another way. So what you're going to see on the next slide is they have a little bit difference in the effectiveness, but they're also going to have a little bit difference on like what it does to change like your body's overall weight loss. Okay, so what we're going to talk about here is dosage, side effects, results, and prescription management for each of these. So this is a big topic today with this medication, but dosage isn't necessarily something that you're going to look at and say, I have to be on this dose exactly. This is something that is actually kind of like a little bit of a trial and error because it's dependent on the medication used, but you want to titrate up your dosage. So basically, your primary care provider is going to give you a dose, and then they're going to say, hey, we're going to increase this incrementally to see how your body tolerates it. And then also, a goal of this, and a lot of people don't understand this, is like, we also want to wean down your maintenance dose. So it's like any medication. If you're given a bunch, we don't necessarily want you to stay on that high load. We actually would like it and prefer it to be weaned down. So when you get prescribed this, one of the big things we'll talk about later is like, utilize your primary care to actually give you an idea of what your titration is going to be, not only up, but also down if we're decreasing that. So some side effects of this, like you may have heard, is like nausea, vomiting, diarrhea, constipation, some abdominal pain, dehydration is a big one, low blood sugar, which can lead to like feeling faint, feeling a little bit dizzy. All of these are side effects that are really determined by the person and the volume of their dosage, okay? So that may change just depending on how much you have. So when we talked on the last slide, there's like the GLP and the GIP, so the semaglutide versus a tirzepatide. The semaglutide usually averages 5 to 15% of body weight loss, where the tirzepatide is going to give you about 15 to 20% of body weight loss. Now that is not lean muscle loss or lean mass loss, that's total body weight. So either like adipose tissue and the muscle itself. So you're going to expect a little bit bigger result coming from the tirzepatide side of things. But when we talk about prescription management, titration is basically only needed for plateaus. So basically, as long as you're doing okay, don't change it, okay? That's another issue that we're kind of finding, is that like people feel like they always need to change it. Give me more, give me more. It doesn't necessarily have to happen like that, especially if you're getting results and feeling okay. It's absolutely possible to obtain a desired effect from like a really small dose, okay? So just because person A walks through the door and they're given a high dose doesn't mean that person B has to be on that same high dose. Okay, so we're going to talk about like a little bit of what you're probably seeing out there. So this top section, these are all quotes that we found from people who provide GLP-1s and GIPs, and these are basically gimmicky lines that you're going to see all over the place. So something like, jumpstart your transformation and qualify in 60 seconds. 12-month GLP-1 weight loss plan, no clinic visit or insurance required, free 2-minute quiz. All of that is out there. Please avoid that. Please, please, please avoid that. What it's basically doing is it's giving you this false hope that like, I'm going to get on this medication, I don't need doctor's help, I'm going to just take it at this random prescription, I'm going to get all this magic pill of weight loss. And we really, really want to stress that this should be under a controlled environment with a doctor or a nurse that is actually watching your prescription, watching your weight loss and how you manage it. And kind of a funny story, I just was like, I wonder how easy this is. So I went on in 2 minutes and 35 seconds exactly, they were starting to ask questions about my credit card information and everything so I could get prescribed a GLP-1. It's that easy to get online. So I really, really recommend going through a healthcare professional for this, okay? So your first step to that, you're just gonna schedule an appointment with your PCP, okay? They will help you determine if you need that medical intervention or not. And then obviously one of the things we're going to talk about, because we're partnered with TriHealth here at the Sports Club, is they have a weight loss management program that not only defines what you should be doing as from the pharmaceutical side, but also from a nutrition side. Okay, so here's some of the latest research when it comes to the medication itself. Evoke or Evoke Plus, they're looking at an oral semaglutide basically for patients with Alzheimer's disease. And remember that big slide that I had where it was like all the things that GLP-1s impact? It impacts everything, including your brain. Then they're collecting data basically about cardiovascular disease, so heart issues and stuff like that, and how this is going to help. Victoza basically is another prescription that just got approved for a GLP-1 injection that has been proven to lower your A1C level for people that have type 2 diabetes. There's a lot of studies out there right now about diabetic neuropathy and how that's improving right now with this medication and lowering use of strokes. But I thought this was a little funny too, because in 20 years, I mean, who knows? Everything is disproven right now by research articles. So what we try to do is go by the most factual things that we can find out there. All right, so going on to the next slide. This is what you have to ask yourself. One, do you qualify? So is your BMI high enough? Do you have diabetes? Are you obese or gaining weight at a rapid pace? And then do you have risk factors like pancreatitis, history of bladder disease? Do you fall into some of those categories? And then the big one is like, are you willing to commit to a concurrent lifestyle and modification with some of these side effects that you may have? Current research is actually suggesting that it may take up to 3 years of compliant medication use for you to even reset your equilibrium on where your body is before you want to just start, weaning off or calling it quits. So this is not supposed to be something short term because you're getting ready to go on vacation. This is definitely something that you want to do for like long term. Okay, so now what we're going to talk about is like what to do when you're on this. So strength training is the number one and most important thing. So a recent study found that a year after discontinuing treatment, patients who participated in strength training maintained their weight loss versus people that didn't gained about 6 kilograms back. Okay, strength training is so important on this. We'll talk a little bit about what happens when you lose weight later and provide that evidence that strength training is that important. Another couple things about strength training is obviously we know that strength training increases your bone density, but there's studies out there that says like when you're taking a GLP-1 and your strength training, it will actually make a more effective strategy for you to have your bone density increase versus if you just take a GLP-1 on its own. And then metabolic syndrome has been studied with this. Metabolic syndrome is when you basically have 3+ conditions that put you into this chronic disease category, and a reduction in metabolic syndrome severity occurs when you're doing GLP-1 on its own, but if you tag it with strength training and movement, it significantly increases your reduction in metabolic severity. All right, so a question that I get, especially like as a trainer and nutritional therapist, is like, how do I get rid of this, right? Well, a lot of people have found out that these medications can actually really decrease your amount of abdominal fat. But when you target abdominal fat, you can't just say like, okay, I'm gonna do sit-ups and my fat's just gonna fall off here. That's not really how it works. However, what they did find is that if you're participating in exercise and taking this medication at the same time, you do get a reduction in overall abdominal fat. Not just necessarily a reduction in just your size, but the actual adipose tissue in your abdomen. And then inflammation. This was a fascinating research article. Basically what they did is they tracked this C-reactive protein, which is an indicator for inflammation in your body. And they tracked this protein when people were exercising on a GLP-1, and that went down. So what that tells you is that it actually caused a decrease in inflammation, where some people may say, well, like, you know what, on this medication, I heard your joints get really sore. Well, if you move and you move properly with the right guidance, your inflammation has actually been shown to go down, not up. All right. Oh, I thought this was funny too. One of the things I want to just briefly talk about is when you lose weight, you lose muscle mass and you lose fat. So what people don't understand is that like if I am actually either on a calorie deficit without a medication, or if I am on a medication like a Ozempic, what's going to happen is I am going to lose weight, but I'm also losing muscle mass as that weight comes off. They call it lean mass, okay? And if you lose muscle as you're losing weight, but you're not strength training, you will eventually lose strength, right? And that can cause a lot of problems, and that's what we're seeing in the industry today, is people are actually losing their strength to such a significant amount because they're dropping weight so rapidly. Now, studies are coming out and they're comparing, okay, is the amount of muscle loss higher when you're on a GLP-1 or a GIP versus when you're not? And it's kind of undecided right now, but my theory and what other people are theorizing is it's not necessarily the medication that is causing you to lose more muscle mass. It's actually the fact that your body is not used to you losing that mass that fast. So you can't keep up with it with the strength training, because people think like, oh, I go on 2 walks a week, that should be enough activity, but you're losing body weight at a rapid pace, so it just makes it that much more important to strength train. So if you let's say you maintain your strength at 1 to 2 times a week of strength training, but now you put yourself on a medication that drops that weight and it drops lean mass, you might have to increase the volume of your strength training to make up for that deficit. Does that kind of make sense? You're kind of doing a balancing act there. So that's why it's so important, because the last thing you want to do is get on one of these medications and then either do minimal to no exercising at all. Something about weight loss retention too is you basically have improved weight loss maintenance when they found that you exercise with it. This is because you're basically helping reset your body's metabolic state. So as you exercise when you're on this medication, you are continuing to keep like a prolonged weight loss management program. So if you ever were to go off the medication, it's more likely that you stay at a lower weight. And then bone mineral density, we talked about this earlier, but movement in general, this isn't just strength training, but movement in general in this study has definitely proven to be effective to increase your bone mineral density then compared to if you were taking this medication and you were off of it. And then some things about nutrition. So this medication its biggest design is that it's going to suppress your appetite, right? Like it actually, like I talked about earlier, it does make you feel more full, okay? You empty less. So that makes it mean that like if you're taking in 50% of what you normally take, that 50% is so much more important that is nutrient dense, okay? Because you're giving yourself more likelihood that you're not going to get as much food, therefore maybe not as much nutrients. So it's so important, like this top study says, that you get the adequate nutrients in. And then a subcategory of that is the protein. It is really, really, really important that you get your protein intake in. Protein tends to be the most satiating nutrient that you can put in your body, so it already makes you feel a little bit fuller. But the other thing is the main building block to your muscles. So one of the most important things you can do is you can get in a high volume of protein when you're on this medication, because you really, really, really want to get a good amount of baseline for your muscle building. So what I tend to recommend to people is when you take protein, they average, let's say, about 5 grams per pound of body weight in a given day. But if you want to increase your protein uptake when you're on this medication, you want to go to upwards of maybe even like 1 gram per body weight of protein. That's a lot of protein, but I promise you, you're probably not going to get that. If you target that, you're going to know at least that you're getting enough protein to help your muscles rebuild. Okay.
What is 1 gram of protein per pound? Cheeseburger, big steak, what is that?
So if you look at like a good example, it's like I use like kind of fists in size. So like a fist of chicken breast is about like 30 grams of protein. Okay, a fist of like red meat, you could talk about maybe 25 to 30. A fist of salmon is 25 to 30. So that's about a serving size people would put on their plate, right? So like lean meats, you can have anywhere between 20 and 30 grams just for that. And a good example is like, well, if you're like, well, how am I supposed to get 100 grams of protein in a day? Well, if in each meal you have 30, that only leaves like 10 left over for you in between meals to have. And 30 is actually really accomplishable if you think about there's protein in vegetables, there's some protein in like rice or quinoa, and there's protein in nuts. So you can have that and just add it up. But yeah, that's a good question. So it's about a fist size, I would say, in most lean meats.
And do you have a list or a recommendation for the nutrient-dense foods to replace nutrients that you might not get if you're not eating?
Yeah, absolutely. And we're going to talk about that on like actually the next slide a little bit. But yes, actually, it's a great question. Okay, so Your body runs better on healthy nutrients, so give it quality fuel, right? So like when we're talking about a balanced diet, the biggest thing is like you want to fuel your body with right categories, right foods. So what we're going to talk about here a little bit is like how are you going to get your body energy storage from this food itself, and how are you going to provide yourself with the right nutrients. So fruit is the number one. That's a simple carbohydrate. So we're going to want you to have plenty of fruit, okay? You can have fruit even if you're thinking, well, this is going to raise my blood sugar level. Well, guess what? If you're on this medication, it's going to help negate that. But the other thing is it's going to provide your body with the energy that it needs to, okay? So simple carbohydrates, think simple because they're simply broken down, okay? And when you talk about that, you say, well, if my blood sugar increases, what's going to happen? Well, that's when you have a balanced diet. So you're going to have things like fruit for simple carbohydrates. You can use complex carbohydrates like potatoes, sweet potatoes, rice, quinoa. Those are broken down a little bit more long term, and I'm gonna recommend that. Those are both really satiating carbohydrate-based foods that are healthy. Then you're gonna do lean meats if you eat meat, so that's more like chicken, that's like salmon, clean grass-fed red meat. And then you also can get into protein sources from like nuts and eggs. And then for me, if you are a dairy eater, like things like a good cottage cheese can also help, something like that. But for me, I also wonder, I look at it this way. When you have a balanced diet with a lot of sources, it's not necessarily about just eating things that give you calories, it's about chemicals. So I'm a big believer in getting more whole food, and people are too focused on counting their calories and they are counting their chemicals. So things that are more whole food are easier to digest, your body's gonna absorb it easier and give you energy, and it's gonna be better to repair your body and improve your inflammation levels. And then when we talk about that, so your body is in GLP-1, so certain dietary choices can stimulate the body's natural GLP-1 production. Remember, this is a hormone in your body that's produced. So your body already has this. So there's certain foods and certain things that you can have that actually produce this, and sometimes people even recommend supplements like this to use too. So healthy fats, so monounsaturated fats, omega-3s, where are you gonna find that? Fish, salmon, those kind of things, nuts, avocado, and then protein and soluble fiber like fruit, vegetables, flax seeds, hemp seeds, all of that. You can use those as ways to stimulate naturally your GLP-1 production. And that's also going to help if you're sitting there and you're like, well, I'm at this level and I feel like I'm getting results, but I don't want to jump up to the next level of my medication. Maybe you would start using something that actually enhances your GLP-1 secretion. And then water. So this has been one of the biggest trends that we found lately in the industry is how dehydration is severely impacting people that are on this medication. Water does make you feel full, and if you're not eating a lot anyway, you're probably gonna recognize that and pick food over water. So taking a firm stance on drinking water is so important with this, and I would say every time you eat something, you have to have water. Okay, that's a good rule of thumb. So basically what happened is they did this study and they realized that your GLP-1 ligands had suppressed water intake after the intraperitoneal administration. Basically, so after you inject the medication, there was a water suppression. So basically what you know is that when you drink or when you take this medication and you drink water, you have to replenish a little bit of a depleted amount. It's like almost like I drove to the grocery store, my gas tank went down a little bit, I need to fill it back up, okay? And so what does this tell us? Water intake decreases when taking GLP-1 medication, and you have to continue to stay on top of it because dehydration doesn't happen overnight. It happens over accumulation of a couple days, and before you know it, you're gonna realize that you have to play catch up. And that's not easy to do when you actually feel like pretty full more frequently through the day. So the recommendation is 80 plus ounces of water a day. All right, but if you think about it, like let's say you have just a bottle of water, you have 4 of those bottles of water a day, all right, you're already almost there, and you just drink any time that you eat some food, okay? So this is a Tri-Health Weight Management Program. Referral is needed to do this, so you're gonna have to meet with your primary care doctor if you wanna go through their weight management program, but it's great because they do work with insurances, they have individualized treatment plans, they can meet you monthly with Zoom, they have nutritionists on staff, and it's basically for long-term follow-up and for success tracking. And then strength training. So we have strength training here at the sports club. We have trainers, we have equipment, and it's a really, really easy way for you to get kind of into things. If you get with a trainer, it doesn't have to be here, but we would recommend one of our highly qualified trainers to meet with and get programming at least for doing this. Okay, and then we have some references. But there's one point that I wanted to address too a little bit, is the big concept of this medication has kind of gotten a little bit of a bad reputation. It's been almost looked at as like, well, is this like a magic pill that you can just take and not do anything? If anybody's thinking about doing this medication, don't feel bad about doing it at all. This is actually a groundbreaking medication that's been out for years, but it's just now being utilized the right way. And if you take it and you work hard, there's no reason to feel any type of guilt or any type of pity that you're doing something like the easy way, because as you can see from this lecture, it's actually not that easy, because you're going to have to exercise, you're going to have to eat right, you're going to have to drink water, because if you don't, you're going to feel the negative effects like that, and you don't want to go that route, because then you're going to have to play catch up. So this is definitely something that I think right now in the medical field, they are really, really stressing to do this the right way, do this with medical supervision, and do this with strength training as well. So I'm open to any questions that anybody has. And if you don't, I can definitely pass on my contact information to anybody too if you want to just chat with me, or I can give you Sarah's contact information after as well. Yeah.
So this program is run by Tribal?
Mm-hmm.
And how do you get the information like, so if I go to my primary care and he gives me a referral, then where do you go to actually get this moving?
Okay, so if your primary care provider will actually just give you the referral to TriHealth, and then they'll all set it up with you from there. So like you guys will be in contact immediately. They're gonna hook you up with a person that's in the weight management program, and they're kind of like your lead contact point from there. So they'll direct you to everything, including like your Zoom meetings and all of that. Yeah.
So you talked about side effects. What are the side effects, how to avoid them, and which ones do you see the most common?
So most commonly I see like nauseousness, a very suppressed appetite at some points, and a little bit of fatigue, but it's very different for everybody. I promise you, like I have seen people take this medication and feel like $1 million, and I've seen people that have been either like overly dosed or they just haven't gotten their body used to yet, and they really feel those effects. Some joint pain is also common, but that can be negated, like we talked about, with some strength training to help decrease the inflammation levels. And then ways to avoid that is, one, to make sure that you're on a really good prescription that you also know is getting controlled as far as volume. So like you're going to be on what we talked about, like that titration. You're going to wait to see your results and see where you're at and listen to the guidance of your doctor before you're like, well, I want to go up automatically. This is something that you shouldn't just jump leap and bounds with. Medications aren't intended to like go twofold over and over and just keep on adding until your body gets used to it. So you're going to definitely want to have a good balance on like how much your dosage is. Yeah. Great.
Do you have a card for information?
Yep.
on this?
Yep. I will give you everything. Yep. Afterward, and we can go from there. Cool. All right, guys. Thank you so much for coming today. Yep. Have a good day.